Salerno, Dr. John Salerno, family
Salerno.
practitioner and patients medical in New York. Dr. Salerno, welcome to the show.
Look, we took so long. He's all relaxed and leaning back in his chair.
We were running our mouths so much about what's going on with earnings season. And it is earnings season, but it's also healthcare season. We've got a healthcare summit tomorrow. What do doctors in general do you think? What do you guys want to hear coming out of this summit tomorrow?
Basically, we want to hear that we're free to practice medicine, essentially, so that we're not governed by insurances and dictated not to order expensive MRIs, for example, when we deem them necessary. We want to be able to practice medicine, not be bogged down with paperwork, insurance paperwork. We want to be free to do what we were taught to do and what we do best, essentially.
And right now, you feel that that's in jeopardy?
I think part of that is definitely in jeopardy, and I think that's one of the major issues that we need to hear as physicians, that we're free to practice medicine, that we aren't told. For example, I had a patient a week ago that was not approved for a CAT scan that I deemed was necessary. We don't want to be told that. We want to be free to order tests from our expertise. That's what we were taught to do, what we know best, and we need to be free to do that.
Well, Doctor, many people will look at the healthcare proposal on the table and say, this isn't perfect. Most Americans do admit that, hey, our healthcare system does need help. What ideally could we do to make things better in this country?
I mean, that's a great question. What I do at my practice, and I really think it's a good model for the future, is that we spend time with patients. We spend at least I do about a half hour. We get to know patients. We do a proactive system. We try to firstly prevent diseases before they occur. We try to get patients in for wellness visits. And secondarily, when they do have issues, we look at their diet, their lifestyle. We want to know if they're exercising. We want to know everything they're doing in the course of a day, what they're eating, what vitamins they're taking. It's very, very important to get that information out. And unfortunately, the way the system is right now, we wait for a disease to occur, and then we treat it with medications and spend 5 or 10 minutes with the patient at most in the office. The system is broken.
Are you worried about lawsuits? How important is tort reform? I can't understand why it isn't even really discussed. I mean, it has not been discussed at length at all during this whole entire process, and I can't figure that out.
Yeah, that's a very good question. We always worry about lawsuits and malpractice issues. Everyone needs to take responsibility for that. That has to change. Tort reform has to be a major agenda on the table. It's causing exorbitant expenses that aren't necessary in the healthcare system. So that, for example, frivolous lawsuits need to be addressed before they're pursued. They need to be washed out of the system. Lawsuits that have merit should certainly be passed. Physicians have to be accountable, but so do insurance companies and so do attorneys. So we all have to really take some responsibility for the entire tort reform, and I think that's a critical issue at this point.
If that happened, would that completely change everything? If you had tort reform included in healthcare legislation with teeth, how much would that change things moving forward?
Oh, dramatically, for sure. There's no question that that's a major issue right now. And a lot of our medicine is defensive medicine. We're ordering exorbitant tests because we're afraid of being sued, and thus it creates a tremendous expense on the entire system. So we want to have that reform, and I think it has to be number 1, 2, or 3 on the agenda. It's critical.
With heading into the summit tomorrow, I guess at the end of the day, do you really think that the president gets it? Do you think he's listening to the doctors, he gets it, and he's trying? Are you getting that feeling from him? Well,
there's a yes and no to that. I think that part of his plan is important because it is a proactive plan, as I understand it. He wants to take a look at patients doing a preventative approach to medicine. That, for sure, is part of a mass plan that needs to be instituted. The tort reform issue he does not get, so there's a pro and con to the scenario. I think we really have to put politics aside with this issue because it's such an exorbitant expense.
Which seems impossible at this point.
Impossible, but it really needs to be addressed, that it's not a political issue. It's really the health care of the entire society. We're seeing kids, for example, that are 7, 8 years old with diabetes that probably would not outlive our generation, unfortunately. They're probably going to live to 60, 70 at best. It's really horrendous. If you look at the medical textbooks, there isn't a disease entity for type 2 diabetes in children. So I just wrote a book called The Silver Cloud Diet, and it really addresses this issue. We have not seen diseases in children particularly that are occurring today. They're 10 years old, they're type 2 diabetics already, or 11.
Oh.
It's the diet, it's the food, it's the lack of activity. Major issues that need to be addressed. So really the politics have to be put aside. It's a very dangerous time in healthcare right now.
That being said, what's your take on the sugar tax?
It's a good question. You know, I'm not in favor of taxing in general. I think there may be better ways to go about that by education, but leaving the choice to the consumer to have what they choose. But on the other hand, I think they need to be educated, and that's part of the physician's job to say, look, we don't like you to have sugar, but there's another beverage alternative that may have stevia in it or another sugar substitute that wouldn't affect blood sugar, for example.
All right, Medicaid, Medicare disaster at the state level. They were talking about cuts, $500 million in cuts. Is that possible? I mean, because this has gotten way out of hand, can you now reverse it and save money with this program?
You know, you can if they take a proactive stance, and that means looking at the entire scenario from a preventative standpoint. And I think that's critical. As I said, we need to address diet. We need to understand the entire modality of our patients, what they're doing from the day they get up to when they go to bed at night, what they eat, what they do for exercise, how they de-stress, and that has to be part of the master plan. And I think in the long run, you can certainly save.
What's the name of your book?
The Silver Cloud Diet.
Silver Cloud Diet. Okay. Dr. John Salerno joining us, family practitioner at Patients Medical in New York, in studio. Thanks for coming down.
Thank you so much.
Good to see
Thanks
you.
for having you.
All right, we need to get